What is a seizure? What causes a seizure? What types of seizure are there? Are the most three important questions. What is a seizure? Firstly, seizure is not a diagnosis, it is a symptom, an abnormal electrical discharge in the brain. What causes that? Something inside the brain is making it unhappy, or something outside the brain is making the brain unhappy. That leads us on to what causes a seizure. Now, there are thousands and thousands of causes of seizures. What's important is not to memorize each and every single one of them, but focus on seizure threshold. So what is a seizure threshold? Everyone has a different threshold for having a seizure. Maybe very high or maybe very low. For example, take myself, a relatively healthy younger person with a healthy brain. For me to have a big seizure in my brain, it's going to take a huge impact. For example, a traumatic brain hemorrhage from a car accident, meningoencephalitis, a massive brain cancer, something tremendous needs to happen to my brain to have a seizure. At the lower end of the spectrum, at the lowest threshold, fast forward, let's say, 50 years, and I am 83 years old with severe cerebral vascular disease, strokes, vascular dementia, type 2 diabetes, heart failure. It won't take much for my brain to have a seizure. For example, a chest infection, constipation, electrolyte disturbance. And in this seizure threshold, everyone lies somewhere in between. For example, another person sitting next to me, similar age to me, with a brain, might be more susceptible to having seizures. And this is called primary epilepsy. We will go into why seizure thresholds are important in later videos when we talk about anti-epileptic medication and the different managements for seizures.